रहेगी।
1 आवर सर।
1 आवर है। ठीक।
हम्म। चलिए। गुड इवनिंग एवरीवन। आज हमारे दिसंबर सेशंस में जो हम डेयर एनिवर्सरी के लिए सेलिब्रेट कर रहे हैं, हमारे सीनियर डॉक्टर लुधियाना से ही, पंजाब से, डॉक्टर मुक्तिंदर सिंह आज हमारे साथ हैं। कोई ऐसा नहीं है कि शायद उनका नाम ना जानता हो। बहुत ही अच्छे स्पीकर हैं इंटरनेशनल लेवल पर, और बड़े अच्छे उनके जब भी सेशंस आए हैं लोगों ने बड़े अच्छे से उनको सुना भी है और सवाल भी करे हैं। और आज का टॉपिक हमारा उनके साथ है पीडियाट्रिक ऑब्जर्वेशंस, जो उनका बेस्ट है। उनकी क्लिनिक में ऐसे अक्सर काफी मरीज हम देखते भी हैं। तो वेलकम सर जी। हम ज्यादा टाइम नहीं वेस्ट
थैंक यू।
करेंगे, तो
थैंक
हम
यू।
स्टार्ट करेंगे। वेलकम सर।
ओके। वेलकम वेलकम। थैंक यू डेयर फॉर इनवाइटिंग मी। एम आई ऑडिबल?
हाँ जी सर, हाँ जी बिल्कुल।
चलो ठीक है। तो स्टार्ट करें, क्या कुछ करना है टॉपिक
सर
वगैरह मुझे?
डेफिनेटली, डेफिनेटली सर, आप स्टार्ट करो। जो भी आपका टॉपिक है, जिस तरह से भी आप स्टार्ट करना चाहते हो।
चलो मैं कर रहा हूँ। मैं थोड़ा सा ना, तो पहले स्क्रीन शेयर कर लें।
बिल्कुल बिल्कुल सर।
तो today I'm presenting a case of an infant, coming directly to the topic. Because what we see in pediatric practice in homeopathy, introduction part is very long, so I'm cutting short. I'm in pediatric practice for last around 25 years, and the actual my actual learning started when I got my daughter in my family. So, and simultaneously at the same time, my friend Dr. Praveen Jain, who is from Bombay, so he also was blessed with kids. So we were discussing that, okay, before that we had a very limited knowledge of pediatric materia medica, pediatric case taking, pediatric emergencies. But when it come to our own home, that we will need to face certain situations where we need to prescribe for the child and had the quick results, because we cannot ask the family to, okay, as we say to our general patients, कि, okay, you take emergency allopathy right now and then we'll treat the child. That doesn't works at your home. You have to deliver the results. And unluckily, there was not much literature into homeopathic arena before. At that, I'm talking of 20-25 years back, when there was hardly any literature available. So we started discussing our family, our own kids' health and general observations, and then we came up with certain understanding, which you all know that the essential of pediatrics and essence of pediatric materia medica, you already have that books. But how it comes to my practice now, then I started taking cases on that basis and started prescribing and started getting failures and results as well. So today's my presentation is of around, it's a pre-COVID case. So when I came across with a small child, one of our patients, he called that our small child has been advised surgery, immediate surgery. Can you help us? So he was in Jalandhar, and two of the Jalandhar surgeons were of different opinion. I'll show you the reports. And they said that it needs an emergency surgery. So, and then, but the family decided that because the surgeons were of different opinion about diagnosis, so they talked to some doctor in DMC, and he said that immediately move the child to Ludhiana. So this was on 28th, that it was a 7-month male child. So they called me on 1st March 2019. And they said the diagnosis is testicular torsion. So child was admitted in hospital in Jalandhar and was referred to DMC Ludhiana for emergency surgery. The complaint was left-sided testicular torsion. Earlier, the child was better. Few days back, had loose stools, and then urine flow decreased. So after 2 3 days, they noticed that there is a swelling, and child was trying to coughing and crying very badly. So I just took some time to understand that what is testicular torsion. So it is a kind of serious and painful condition where the spermatic cord twists, cutting off blood supply of the testicle. What happens is that it is not a congenital disorder. It is an emergency where the spermatic cords suddenly get twisted around the testes, and in here they kind of throttle the, as you see in the right picture. So they just twist over the testicular blood supply and cause the swelling of epididymis, and the whole of the testes, they are devoid of blood. So this causes sudden severe pain and swelling in the scrotum. So it's a kind of medical emergency that requires immediate treatment to prevent permanent damage to the testicles. So there is no time to think, as you might have seen some cases of um, kind of acute appendicitis. So this comes under the same category. So symptoms are child gets severe pain in the scrotum, swelling in the scrotum, abdominal pain in the scrotum, in the lower abdominal region, nausea, vomiting, testicle positioning higher than normal, and fever. The child was presenting with all the symptoms. So if you go to the pediatric emergency medicine, they say the testicular sharp, there are the diagnostic criteria for that, that there is a large testicular swelling testicles is hard, and the cremasteric reflex is absent. So what is this cremasteric reflex is? It is uh, it's also called Prenz signs. When they press and they just do the manual cunning, so that retraction is not there. So that nausea, vomiting is there, high riding testicle is there. So this all these signs were present. So there is this torsion before swelling. So manual detorsion can be done if there is no swelling. So what they do is they manipulate, they do a maneuver by pressing the testicles up into the deep into the spermatic cord, and if there is no swelling, they do it, and then when they release the testes, so sometimes that torsion is released. But here, once the swelling is present, then you cannot touch the child. So in 2/3 of the cases, testis torses medially, 1/3 cases they test laterally. So if pain relief, this is called manual detorsion. But if it is detected earlier, but once there 6 hours of swelling is there, then you cannot detorse it manually. Then surgery is the only condition. So if it is said that before 6 hours, if surgery is done, that is the classical. But if 6 hours to 24 hours is the warning period. But if it passes by 24 hours, then it can be particular damage to the testes. So that was the condition. So if we see the ICD coding, so it is torsion of testicles comes under N4 4.0. So that is very important. So how is testicular torsion treated? It is treated only with the surgery, which is done as soon as possible. For the best chance of preventing permanent damage to testicle should be done within 6 hours from the pain started. But this child got so condition which is uh, presenting is twisting of cord that supplies blood to the testicles. This causes sudden and usually severe pain and swelling. So urgent medical attention is usually recommended by healthcare providers, can be dangerous for life if untreated. The rare fewer than 10 lakh cases per year in India. So it is a very rare condition, acute condition, treatable by a medical professional. And so that was the condition of the patient, to cut short. So child was hospitalized. Child was irritable. And if I go back, so I'll show you certain reports. The child, they presented me with the certain reports. So the child is, so this was in Jalandhar. They said that right side there is a swelling. It was on 27th February. Child was brought to me on the first. So already 24 hours are passed. So they said that there's a very common use, and sometime you need to remove the testes. So they said that it is orchitis or epididymis. So one surgeon solved that. Then they went to other hospital, Bhargava Hospital. They said that this torsion with left testis is there, and pain, swelling left. So it is a classical side. So they need the immediate ultrasound also shows. So right is normal, left is higher and tender. Left testicles is higher and tender. So they said that you need the surgery. So this was the first ultrasound done on the 20. It is on the date 28th. So second day. So they said both test is normal in size, but this is acute epididymitis, left testicular sac with mild stained hydrocele. And then we prescribed the medicine. So this was another opinion taken by the third of the doctor. So in the 3 days, 2 days, 24 hours, within 24 hours, they went to different, and ultimately they were sent to Ludhiana for the surgery. So on the way, they called me, the doctor said, this is the condition. So this says that left testicular findings are likely sequel of torsion testis, as hematocele is also made. So there was an added on complication, that was hematocele. So this was the condition of child, and the child was brought to me. So first of all, I would like, if it is an interactive session, can you tell that what would you like to do in such cases? Would you like to intervene, or as it is a life-threatening situation? So what would you do if it is your family member and you will, what is your suggestion as a doctor? Yes? Am I audible?
यस
Hello?
सर ऑडिबल है सर.
तो क्या करोगे आप ऐसे केसेस में? व्हाट यू विल डू? एनीवन?
सर सभी डॉक्टर्स का अपना अपना वो रहेगा. आई थिंक यदि इमरजेंसी है तो आई थिंक आई विल रेफर टू द हॉस्पिटल.
तो मतलब वी शुड नॉट टेक द रिस्क.
नहीं सर, टाइम पर भी डिपेंड करेगा कि टॉर्जन को टाइम
टाइम तो
कितना
मैं,
हो गया है.
टाइम आई टोल्ड दैट दे सेड दैट ऑलरेडी 24 hours are passed. Life of your child is at risk. You might lose the testes of the child. That is already told. A surgeon has already asked them, I'll know it is a complicated case, I'll not operate upon.
सर एक ट्राई करेंगे.
तो क्या ट्राई करोगे?
मेडिसिन
Okay,
सर.
good. If you will try, I'll give you the symptoms. The child is hospitalized, being moved to Ludhiana from Jalandhar. The child is irritable, not taking proper feed, but taking it regularly, meals, feeling hungry. Then the child is not tolerating much covering, side left. So this was the only information available.
So can we give on his irritability and everything, tarantula?
कैमोमिला.
Chamomilla, okay.
Tarantula.
Tarantula. Why tarantula? Why chamomilla?
सर
If there is
उसका
a
सिम्टम
child
होता है
in
ना
pain, if child is in pain, so how will he present? The weeping is a basic reflex. Any child can weep in hunger, in pain. So how can we take that irritability as the main symptom?
सर एक उसका tarantula का सिम्टम है कि that test is adhered to the scrotum. ऐसा कुछ,
Testing?
क्योंकि एज सच वो पेन के साथ होता है मेल जेनेटिलिया में.
Okay. Any other suggestion?
सर यदि केस लेना ही होगा, पहली बात है इमरजेंसी को देखते हुए अगर
So
रेफर
you
कर देते
hardly,
हैं
you cannot ask them ना भी आप मेरे पास लाओ 1 घंटे में केस लूंगा मैं.
हाँ
You
हाँ, तो
cannot have that
अगर
liberty
उसको
of.
यदि हमें लगता है कि वो
You
पेन में है और
can you imagine a 7 month child, male child? So what would be the condition of the parents? Can you imagine?
यस सर.
So what will you proceed? This was the information I got on the phone. So, okay, still I tried. So they said that otherwise child is very happy-go-lucky child, but sometimes he weeps when something is taken away from him, right?
Staphylococcus.
Okay, good. Why Staphylococcus?
I took this weeping condition. So,
Sir, weeping, see, first of all, our motive is that we should take something very pathological. So weeping in a child, until unless there is not a video, you cannot make the difference. So weeping cannot be taken as prescribing symptom in 7-month-old child. How will he express is that is the only expression, smiling and weeping. Rather, weeping is the 80% the language of the child. 80% language of the child is weeping only. Only 20% is smiling when the child is happy and so how can we take it as a symptom?
right, sir.
Hmm?
I said
सबसे
right.
पहले हम एकोनाइट से भी ट्राई कर सकते हैं.
Why aconite? So we should not see what I have already told you the emergency situation. Are you in a position to hit and try?
No, sir.
Can
But एकोनाइट में after
if I prescribe, I need to have something very solid.
Okay.
We cannot just try. No, that is where our homeopathy is lacking.
Sir, you had
If
mentioned
I-
something about feeding. Feeding of the child.
Feeding as it decreases, that is also again if the child is posing, you simply get a fever, your food intake decreases.
Yes. So belladonna is the remedy, I think.
Why belladonna?
Uh,
I need why? Because I have given even my assistant doctors to ask me why. I have to explain every case to my assistants even if I'm prescribing. I can never say that नहीं मैंने तो यही देनी है तो ऐसे ही दे दी out of it. I need solid reasons. See, you are walking through a ground, so in a mud. To put your feet, you need some solid base. If you put your face without a stone under, you are 100% likely to get slipped and get injured and trapped into that mud. So for prescription, you need to have something very solid in your hand. Agree or not agree?
agree,
Yes,
sir.
sir.
Completely agree.
So, crying and decrease in food in acute emergency. The child is already hospitalized for 2 days. So does it make a sense that to prescribe on lack of little appetite and weeping? I would never take that risk. That
Yes,
would
sir.
better than that is to refer the patient why to DFM or homeopathy. Yes, any other solid suggestion?
Sir, belladonna because cries when possessions are taken away by other kids.
Okay, that is something which is constitution. So here on this slide, I have given two symptoms. Patient is approaching and patient is possessive. So see now the trace the dots in acute emergencies. Dr. Hanneman says, whatever totality is available, you play with that. So now we have some additional information which the parent said that he shrieks when angry, but he said that he is allowing a doctor to examine himself. So he startles and cries. There is a profuse perspiration on scalp. These are general symptoms. He sleeps on abdomen. Otherwise, he's a good eater, thirsty and hot. This is the symptoms I got. So I would give you a glimpse of the child also because this was taken after the child got much better. So can you see the screen?
Yes, sir.
Yes, sir.
Yes.
But the video is not playing. अभी अब video play कर दो.
Yes, yes. This is in follow-up. This is a follow-up video, no doubt. You can see the shining swollen testicle. Can you see
Yes, sir.
Yes, yes.
Mhm.
swelling in the left testicle? This is a shining in the left testicle, if you can see. That is in follow-up. Can you see the difference? Both testicles, right and left.
Yes, sir.
Now here, can you see?
Yes, yes.
Can you see the difference in right and left testicle? There are shrinking of the right is normal, but left has a swelling,
Yes, sir.
right?
Hmm. Yeah.
Another video of the child is this one. Now here, after the medicine in the follow-up, if you see there is a right was normal. Now left has shrunken to such an extent that left seems smaller than right now after the medicine. Can you see here? I'll show you again. Because this is a ascent of, so you see the left testis has gone up, right has now is going down. It's a normal condition, but still it is on the upper side. Can you see?
Yes, sir. It's visible.
Yeah.
So this was the child when before 1 day after the medicine, when I asked them not to bring to the hospital, I told them I'll give you a dose. This was on 2nd of March. The child was asked me to be prescribed on 1st of March. This is on the 2nd of March. The child was now at home, was no need of a, so I confidently said that don't go for surgery. A glimpse of child also. Would you like to give him tarantula, chamomilla, staphylococcus?
सर कैलकेरिया का आप
Okay, why this now? Child is
सब
hot and left-sided. I never go for hit and trial method.
Lachesis, sir. Left-sided and hot patient.
Laxis.
Why laxis?
It's left-sided and patient is hot.
Left hot, very good. There are sulfur is also left and hot. This is in the follow-up. This is follow-up after 1 month. This is my clinic. If only left and hot is the criteria, then there are many remedies like left and hot. If I put left and hot, so if I go to the generalities, side, left. And if I put a thermal hot, okay, I'll put my repertory. So left and hot, we have many remedies. Promila, ये कौन कर रहा है स्क्रीन पे राइट स्क्रिबल? ये डिसेबल कर दो एनोटेशन. Yes, ma'am, someone is saying left and hot. So we have many remedies of left and hot. Argentum, apis, crocus, iodine, laxasis, sulfur. So laxasis is in top 10, but why laxasis only? जनता जवाब मांगती है, बोलो। हेलो, सो गए?
सोए तो नहीं है सोच रहे हैं कि पीडियाट्रिक केसेस में कैसे एक्सप्लेन किया जाए।
नहीं, you have to have some logic ना।
हाँ हाँ,
तो
सब अपने
अब
अपने हिसाब से चलेंगे।
हमारे पास तो ये अभी 40 दवाइयां आ गई। लेफ्ट
हम्म
आउट, आई अप्रिशिएट योर अटेम्प्ट एंड योर
हम्म
approach. I appreciate that.
हम्म
Undoubtedly, I appreciate that. At
हम्म
least you have been on the track. Maybe आपकी दवाई भी सही हो, but कैसे सही है, क्या सही है?
हम्म।
So
एक्यूट
further
केसेस
information,
तो
I'll
हाँ।
give you further information which I got in the follow-up only. It was not my first-hand information. This was after child start got better. So we took the whole case. So he is a sociable child. He accept new food, comfortable in gatherings and plays well. Patient smiled when entered into doctor's cabin in follow-up. When touched, child smiled. Start crying when placed in car seat or stroller. So patient likes to get face washed and hair brushed, looks and takes the toy when offered. At new place, child sit quiet and observe surrounding. Smiles when happy. So these days he is a cranky child, cries loudly when get wet in nappy, cries loudly when get hungry. Time to pass stool is unpredictable. Sleeping hours are less sensitivity. If there are some tags in the clothes, he gets disturbed. So activity is normal. He is an approaching child. Reaction to examination, he allows examination. Sensitive to loud noise and tags in clothes. So this is the totality. I got hot, thirsty, side left, clinging, and certain things. So here my experience came into the play. So now I'll definitely the remedy I prescribed was laxasis. Child is approaching, clinging, hot, left, and thirsty. This was the totality I reacted for the child. And medicine given was laxasis 1 m on the 1st March. Follow up 2nd March, they said same, but swelling come होनी शुरू हो गई है. March 4, child is better now, no swelling, child is playful. March 22, after 15 days, left testicles is small in size now, loose stool. Now, they said that because if you remember in the history, they said there was a diarrhea, and after suppression of diarrhea, he got that sudden pain in the swell. So that diarrhea returned, and I asked them let it continue and let it continue for 15. It was continued for 15 days. As the diarrhea was progressing, the swelling was getting better. So they said that in the morning he goes 2 times, and otherwise also, what happened now in this case was that at the age of 7 months, what is the period of child's life? 7 months. What is the milestone which we expect at the age of 6 months plus?
Teething.
Yes, dentition.
Yeah.
Sitting and teething.
Yes. So the child got dentition diarrhea.
Yeah.
And they suppressed it. Now, this is a very, very important information for here for when you are dealing with the pediatric cases. You need to understand the milestones. So if that diarrhea is suppressed, the child got severe diarrhea and he get anuria. His urine output was decreased. And they got panic. They gave him strong antibiotics. And after that, the child started getting that pain. So we have to allow that diarrhea. We have to keep the hydration in consideration in kids and in any age. The management of diarrhea, according to homeopath, has to be given the indicated remedy along with lot of hydration. If you are not asking them to hydrate, you might lose the patient because the reason for admission in diarrhea is dehydration. So here comes the management part. And then they said that they lose stools. So when you educate the child, the parents, in pediatric practice, most important thing is handling the anxiety of the parents. If you can well handle the anxiety of the parents, you are the winner in pediatric practice. Although you need to know the red flags, you need to know where to refer the case. Yes, that I agree. So activity was normal, teething, lose motion ठीक हो गए, but फिर होने लग गए, lose motion again started, and that was the child. So now I'll go to the materia medica part. Uh, So this was my workshop in Malaysia. I took that case in 2019 over there. So Pramila said that you sir कोई case लो ऐसा जो आप ना पहले लिया हो. So that's why I took out that case. So actually, this need pediatric teaching needs a lot of time to understand. So I'll show you some of the videos of approaching cases. So these are the approaching means child is. हाँ मेरे पास किसी में चॉकलेट है देखिए भाई ये है मेरे पास पैसे हैं ये देखिए so this is when the child is coming near you and is having eye contact but at the mother's lap. So this is something very peculiar of Alexis child. I'll teach you a bit about कितना time रह गया रोमिला
अभी है आप 20 मिनट
सर हाफ एन आवर है
कोई बात नहीं सर.
good. See, this is another child. So Lexis, the most important point of Lexis is that child is comfortable having good eye contact with you from a distance. The moment you ask the child, they will cooperate for examination also, but they will ask mother to come along. So this is a particular child of Lexis again. This was another case of Lexis which I treated. So I have see Lexis is the perhaps the second or third most prescribed remedy into my practice. So if you see that child, I can prescribe Laxis on this much of clip, what I have seen, what I am showing you. Mm, Because there are so many presentations, so it's difficult to hard sort out करना मुश्किल हो जाता है.
लैकेसिस वाली ढूंढ रहे हो?
हाँ, मैं थोड़ा बहुत लंबी प्रेजेंटेशन है, देख 300 स्लाइड्स ने, so I'm trying to sort out that particular part. ज्यादा में से थोड़ा ढूंढना मुश्किल होता है ना.
ये रहा एंट्री पॉइंट्स
हाँ,
लैकेसिस के.
इसी पता नहीं क्यों हैंग हो रहा है. नॉट रिस्पॉन्डिंग आ रहा है. I'll just. So Lachesis is, I'll show you some videos. That's why I'm trying to. Presentation ज़्यादा हैवी है तो उसको थोड़ा टाइम लग रहा है. तो when you start thinking of lachesis, whenever there is a child or an infant who is having very good eye contact with you. क्यों पीसी हैंग हो रहा है. So I'll just keep till it loads. So actually, when you see a child who is making good eye contact with you, who is coming close to you, but from a distance, means when the child is, there are a large group of remedies. So what I was telling you is that we sorted the materia medica into two parts. Because what we called as introversion and extroversion, what we call as approaching and withdrawing. So withdrawing are the kids who just turn away your face when they come to you. They are not ready to enter into your cabin. They are not interacting with you. So for the approaching remedies, we have got this, there are different groups of remedies. सबसे पहले, the animal group of remedies, bees, spiders, and snakes. They are approaching, you see, because their sociability is well developed. So all the spider remedies, all the bee remedies, all the snake remedies, they are the approaching remedies. In plants, if you see, they're ornamental plants like lilies. So all lilies, veratrum, Paris quadrifolia, the Crocus sativa, this even alliums, all these, they come under the Lilium tig and Senecio oriens. All these remedies, they are approaching remedies. Because flowers, what are the flowers? Flowers are the plant have flower to attract. So whenever there is attraction, whenever there is some close proximity, whenever there is a sense of sociability, means others should come to me. So the child is inviting you to be involved with him, to be in conversation with him. Then it is an approaching child. So the ornamental plants, lilies are, they are the sexual part of a plant. They are reproductive part of plant. So means that they are meant to attract butterflies. They are meant to attract the insects so that there is cross pollination. So that attractiveness makes all that ornamental plants are approaching remedies. Then mint remedies, as you see, the mint remedies like ossimum, like peppermint, like all these remedies. You see, if you see the ad of mint close up or peppermint, these days kids are eating a lot of peppermint and all these things. So they say that close up means if you have good smell in your mouth, the girls will get attracted to you. So that is again a sense of attraction. So I see all those approaching remedies, all mint group of remedies are approaching and hyperactive remedies. If you, I can have a full presentation on mint, means they are hyper energetics. If you see all the ads of mint, there are mint toffees, mint chocolates, mint flavor in everything. Why mint is so popular? Because mint is the need of an hour. So everyone need to be hyper energetic. Everyone need to be approaching, means you come near me, come close to me, because smell of bitter orange can be a repulsive thing. So to fight that, people like me and they keep with themselves busy. So I'm not going into the detail. Then there is a third group of drugs. Drugs means drugs are of three types. One are depressant drugs like alcohol, opium, morphine, which cause depression. Stimulant drugs, coffee, thea, coca. These are the drugs which stimulate. And deliriant drugs, hallucinogenic drugs, cannabis indica, hyoscyamus belladonna. So all these drug remedies, they they say it is said that if you take a drug, all your inhibition, all your timidity is gone. You are approaching. So they make this group of remedies a approaching group of remedies. Then comes the sugar, saccharum album, saccharum officinalis, chocolate, these sweet remedies. They are again attractive remedies. They invite you to come close. Then milk remedies, so saccharum lactis, lactic acid, laccan. All these again remedies, they are again approaching remedies. So you got an idea. So this is what our approaching materia medica in pediatrics is. So if there is a child who is approaching, coming to near, then you need to think of this group. They start going into our mind. So animals, as I told you, snakes, spider, bees, animal products, plants, flowering plants, drug remedies, sweet plants, fungi, bovista, alcohol, badiaga, agaricus. These are the approaching. Minerals, only two groups, sulfur and phosphorus. And some of the iodines, only three, whole of the periodic table, only three, sulfurs, phosphorus, and to some extent the halogens, means iodine out of halogens. These are approaching drugs. And nosodes like tuberculinum, syphilinum, these are nosode drugs. So I hope you got the idea. Then approaching snakes, spiders, other animal remedies, and polycrest, phosphorus, sulfur, iodine, veratrum, and tuberculinum. These are the polycrest remedy. So in approaching, again, non-approaching and hyperactive plus destructive group of remedies, if hot. So we get these remedies. This is how I reached that remedies. It was a destructive pathology, life-threatening pathology. The child used to throw the things, child used to be destructive, shrieking, crying, and he won't give the possession. So I need a possessive remedy. I need a left-sided remedy. I need an approaching remedy. I need a hot and thirsty remedy. Now you got my totality. Apis is right-sided remedy. So it was ruled out. Iodine was, I said, skinny remedy and an irritable, not very approaching remedy, but iodine, I said that they are partially approaching. So the remedies which left to me was lachesis, tarantula, and tuberculinum. And if I go to the chili group, these are the remedies of chili group of. So group of animals who use chemical weapon rather than physical for their self-defense. So they have venoms in it. So these are the three. Because when this Alexis child is in school, it is complained that there is a child. They said it is very talkative. If someone offends a Alexis person, he will have a verbal arguments and verbal revenge, not the physical revenge. Alexis is smart enough. So they have a poison. So they will say poisonous words, bee, spider, and snake. Now, there are three main group of approaching remedies which have good eye-to-eye contact with. So if you see a child is entering into your cabin and you need to take care of your belongings, you need to take care of your torch, your stethoscope, your books, means you are at guard, means it is a spider. And if no one at God, the child is busy in his own life, he is not bothering you, he is not at all. But otherwise, if you ask a question, he will answer. No one at God, neither the child nor you. Then it is a bee remedy. And if the child is at God, means he is cautious, then it is a snake remedy. So this observation can give you miraculous result in any situation. So if you need to be at guard when the child is entering your room, it is a spider group of remedies. If the child is at guard, means initially is entering as a timid person and then taking hold of the things, is then overpowering you. If you give them space, if you give them smile, if you give them a toy, they will come near you and then they'll start snatching your keyboard, snatching your pen, and snatching your mouse of your computer. Then initial timidity, strong timidity, and then approaching. Then it is Alexis or the snake remedy. You got my point? Hello?
Yes, sir. Hanji.
Yes, sir.
Yes, sir.
So I'll show you videos. Now this you have to tell me. Hello. Oh. What child is doing? He's trying to open the drawer. She's trying to hurt. They take over all the everything. He's not uninhibited. So this is a definitely a tarantula child. But now see this child. This was a child who's मम्मा का नाम क्या है? अच्छे से बताओ. Speak properly. What is your mama name? What is your papa name? And what is your sister's name? Anna. What is your dadi name? And what is your nani name? See how talkative and how attractive the child is. But he is again not coming close to me. आप सिख फैमिली से हो? तभी एक्चुअली मैं जब भी किसी सिख को देखता हूं तो कहता हूं नो डोंट शो. तो अगर ये नालू है तो थोड़ा फ्रेंडली पासवर्ड नहीं है आपके. बाय. See, now this is a classical Lexus child for me. So tarantula immediately busy when they come to your cabin playing with himself and things around, physician becomes cautious. Lexus with cautiousness, child makes eye to eye contact but will not come immediately close. And Apis will be not bothered, he will be busy into his. So Lexus is inquisitive and intelligent religious. So that is the child, this generation of children talking, making faces and doing a lot of things. They are like copying the others. So this is a particular Lexus child. So this is an Apis child that he's busy, not breaking the things, not getting, you are not bothered, you are not worried. बच्चा है cabin में तो कोई बात नहीं, वो अपने में busy, आप अपने में busy हो. So tarantula is very fast, very quick. So Lexus, now you see, this is an Apis on the left, this is a Lexus, and this is a tarantula. So when your energy is out of control, then it is a tarantula. When energy is in control, then it is a Lexus. And when that energy is not harming you, means like a bee, honeybee, you don't bother them, they will not bother you. But the mere moment you offend them, then they will not leave you. Am I able to communicate?
Yes, sir. Yes, sir.
Yes, sir.
So when this approaching, hyperactive, destructive plus cautious. So when you get this combination of approaching plus cautious, very strongly cautious, then it is a Lexus child. So infant is who is having good eye contact, cheerful baby, mouth, tongue protruding in and out, refusing breastfeeding, because that suffocates them. So if a snake is to be held, you cannot hold it from the mouth or from the tail. You need to hold the Lexus from the neck. So whenever something is obstructing their respiratory and oral passage, they are in panic. So that is a laxus understanding. So cyanotic child, then toddler is approaching baby, hyperactive baby, approaching but does not allow you to examine. Precocious child will ask many questions. Why this, why that? Complaints after birth of sibling, because it's a jealous child. So sometimes say that pulsatilla child is also, but they are in and around mother's lap, both will be in and around mother. But laxus is approaching but timid, while pulsatilla is withdrawing and shy. Pulsatilla is never an approaching child. It is a chipku child, rondu child. So Alexis is a smiling child. In schooling, they teacher say very talkative, blah 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 blah. It is उसकी सीट ही चेंज करते रहेंगे teacher. Don't sit here, don't sit here. इसके साथ नहीं बैठो. तो always blah blah child, mischievous, plays tricks in school but never caught. So that is the beauty of Alexis child. They're so smart, they will never be caught. Witty, jesting, sharp. So you see these days there are serial that Nagin and the children with large eyes doing a lot of dances and presenting very center of the stage, attracting everyone towards them, mesmerized desire to. So this is a kind of era of snake babies. Mixing baby, answer all questions without any hesitation or fear. Does not allow to examine. But when you ask them to examine, open your mouth, then they'll go to the mother's lap. Ask the mother to go along with. Very possessive about their friends and does not want to talk to others. So these are the laxus child. You see that sibling jealousy is a great thing. So they'll just have the hitting. So but whenever they get time, they hurt the children. So when the new baby in the family, laxus might get sick. Otherwise, very intelligent children, precocious children, ahead of their age. Parents will say he's very smart child, very quick child, very good learning child. So elegant, defender, not attacker, good hunters, they make their presence. So elegant snake remedy, elegant in their movement, rhythmic movements, good at dancing. So if it is a rhythmic dancing, award-winning dance is Lexis dance. Defender, not attacker, not aggressive. If you give them respect, they deserve. That's why snakes are worshipped. So it is thought that if you give them respect, they will not hurt you. They bite in defense, camouflage use करते हैं, bright colors, rattling noise, approaching patient. But when they enter inside, they are initially withdrawing, cautious, will closely inspect everything around. And once they are sure that there is nothing harm, they will show their true colors, but not want to be examined, timidity. So these are the entry points. Heat sensitive, eyesight, smell. So if hurt, they will take revenge with tongue. So they will pass comment on person who hurts them. They are censorious, witty, inclination to humor and jest. So Alexis is loquacious, jealous, precocious, witty, timid, mischievous. I'm running fast so that I give you a fair idea of Alexis. The differentiation with Tarantula is Lexis is rhythmic movement, verbal revenge, talk loquacity. While Tarantula is erratic movement. You cannot dance on the floor with Tarantula. They will आपकी टांगे तोड़ देंगे, आपका मुंह पे हाथ मारेंगे. So they don't have rhythm. They have energy. So their revenge is physical. If you hurt them, they will hurt you back. And talk is abrupt. So Tarantula tear thing, throws things, bite, strike. Apis is not that destructive. And Lachesis, so if you see the destructiveness, Tarantula is at number 1, and Apis and Lachis are at back end. While jealousy in Lachesis, it is more than anything else. Apis has even jealousy, but Tarantula won't have jealousy. They have their own energy. So left-sided is Lachesis, right-sided is Apis, and Tarantula can be both-sided. Thirst, Lachesis is thirsty. Tarantula can be any, while Apis is thirstless. Right? So, Promila, we can keep a question answer session now.
बिल्कुल सर, कुछ क्वेश्चंस आए भी हुए हैं.
अच्छा, पढ़ो.
डॉक्टर मदिहा ने पूछा है, कैन ए चाइल्ड बी एट वन टाइम लैक्सिस एंड अनदर टाइम टैरेंटुला डिस्प्ले?
If you are not clear, then this can happen to you. But once you are clear, So you are asking that do you confuse between the two girls? Masi and mummy can sometimes be masi, can sometimes be mummy. No, tarantula is tarantula, axis is laxis. In homeopathy, there is no substitution. Either it is laxis or tarantula.
डॉक्टर श्रुति का है
They are like sisters. They are like sisters because there are many things which are overlapping between laxis and tarantula, no doubt. But still you have to match the energy level, match the other things. You will get result only if you give laxis to a laxis, not laxis to a tarantula or tarantula to a laxis. The result will come only if you prescribe laxis to laxis. Got me?
सर इसका एब्रप्ट में को एक बारी समझाएंगे इसका टेरेंट्यूला का एब्रप्ट आपने जो बोला
Abrupt
था
means unpredictable. You cannot predict
Okay.
where the tarantula will go. It is abrupt, sudden. Means abrupt
Okay.
can be speech, can be abrupt, actions can be abrupt. It is different from awkward. That
Okay.
agaricus is awkward, but tarantula is abrupt.
हाँ
Abrupt
मतलब
means
ये
you
गुस्से
cannot
में
say,
कुछ भी
अगर
गलत वगैरह बोल सकते हैं
आपके पास खड़ा चाइल्ड तो पता नहीं आपको कब थप्पड़ मार दे tarantula.
ओके मतलब हिट बैक होता है टेरेंट्यूला का
Tarantula
मतलब
definitely physically बहुत ज्यादा
वोकल
unmanageable
एज वेल
energy
एज
होती है.
फिजिकल ओके
Unmanageable
ठीक है
energy.
ठीक है सर थैंक यू
कोई और सवाल हो तो प्लीज वीडियो ऑन कीजिए अनम्यूट कीजिए
There are many symptoms of laxis like aggravation during sleep, cannot bear tight around neck, or ambitious. They are anxiety salvation. So there are different. In COVID, I had a series on laxis of around 48 hours, only laxis. So it is a
सरफराज आप
big thing. That's why I said that it is the second most prescribed remedy of my practice.
सरफराज सामने आइएगा बेटा जरा
है?
सरफराज सवाल पूछो सामने आओ सवाल है सर हाउ टू रूल आउट लैक्सिस एंड टेरेंटुला आई थिंक काफी बार बोल चुके हो आप दोनों में फिर भी शायद कोई
See,
कंफ्यूजन है
tarantula is unrhythmic. Tarantula is having 8 legs and laxis has no legs. I'll give you an example. So 8 legs means can move into any direction, but laxis is a kind of creeper. So they need to find the ground. Tarantula can work in air. So tarantula has more 8 times energy than laxis. So number one difference is energy level. Second is inhibition lack of. They will never be cautious. Cautious means you are entering into a place and you are assessing the situation and then showing your colors. But tarantula need not to show his to access that what is danger in front. They will just attack. They are attackers. While laxis are defenders. They will defend themselves. They will find their space. They are not attackers. So tarantula are attackers. Laxis are defenders. So another is tarantula side is not very specific, but laxis particularly has a side affinity. Then thirst is very specific in laxis. Laxis is hardly thirstless, but tarantula can be thirstless also. So tarantula is laxis is one of the remedy which is hard to inferior and kind to superior. Means they manipulate the situations, they evaluate the solution. But tarantula is not at all. They'll just do whatever they have to do. Got me? Got the
सर
answer?
एक और सवाल है
हाँ जी
बिल्कुल जी सर एक और सवाल है डॉक्टर अंचित का सर कैन अप्रोचिंग चिल्ड्रन बी फाइंड इन मिनरल्स और प्लांट फैमिली
I told you phosphorus, sulfur, and iodines. These are approaching kids. Otherwise, whole of the periodic table is full of withdrawing remedies. So if it is Kali, Kali phos can be approaching, Kali iode can be approaching, Kali sulf can be approaching, but Kali bichrome, Kali mure, Kali carb can never be approaching. So all carbons are withdrawing, all silicias are withdrawing, all brightas are withdrawing. So whole of the periodic table only phosphorus, sulfurs, and few of iodines they are approaching.
कोई और सवाल हो तो भाई प्लीज
Like
सामने आइए।
if you see the palladium, sometimes they are self-praising, they need praising. So sometimes they are social, very social. So palladium. So there are very few approaching drugs in periodic table. Otherwise, the periodic table is full of timid remedies. All magnesiums are timid, all silicas are timid, all carbons are timid, all and the nitricums can also in some shades can be approaching, as in argentum nitricum, they can be an approaching remedy. So very few minerals, but yes, it is not a rule that no mineral is approaching. That is nothing like that. You need to know the materia medica.
Sir, one question I want to ask.
Hmm.
Sir, one child comes to my clinic and takes away the torch and takes away the stethoscope and then wants to hear his heart sounds. He says, I will take this home now.
See, this can be after he's familiar with you, multiple visits,
Yeah,
or
he has done multiple
so
visits.
this cannot be taken as a prominent symptom after. I'm talking of the first visit, most probably to the strangers. Now you are no more a stranger, you are a kind of family. So this cannot be a prescribing symptom in that case.
But sir, sometimes he
But
throws
definitely,
also.
child seems to be an approaching child.
हाँ.
So what is his means? Many a times, what happens is that kids in my clinic, they are quite comfortable with the assistant doctor, but as they enter into my cabin, they again start withdrawing. So that from there I evaluate. So how they are behaving in strange situation, give their constitution.
Yeah.
Clue to their constitution. But once they are familiar, then you need to consider other points, their obedience, their diligence, their reaction to situation. There are so many things. But you
And-
can assess a child by this observation that he wants to take away that way. So this is a quite childish, and they don't have that. So it opens a lot of material medica in front of us. No particular.
One thing more, sir. When I ask him to show his throat, he'll say like that. He will over give a loud sound.
That can be any approaching child, So there are so many things. A sulfur can do that. Exhibitionist, even hyosemus can show a big mouth. So there are many plant, even veratrum. So all these, I have given you a large range of remedies which are approaching. So it can be any remedy.
इसके लिए शायद हाउलिंग वर्ड है ना,
It is
जोर
not
से ऐसे
howling.
फटे
It is
वाले
not
निकालना।
howling. No. Howling is a pathological sound which comes in very severe conditions. You cannot take it. I don't know what your approach is, but I will not take it as howling.
Okay.
Thank you, sir. Thank you.
See, if you stick to what is there and what is not there, then your practice would be much easier. जो है सो है, जो नहीं है सो उसको interpret मत करो. This is my way of practice. जो है सो है, उसको respect दो.
सर एक क्वेश्चन, सर आपने इस केस में लैक केसेस इस चाइल्ड को 30 में दिया है 200
1 में I showed you the slide.
1 ओके
1 M.
ठीक है,
Single dose.
सिंगल डोज, ठीक है सर, थैंक यू।
बाय बाय करें।
कोई और सवाल हो तो प्लीज। कोई सवाल नहीं है सर जी।
या तो सब कुछ समझ आ गया या कुछ नहीं समझ आया।
सर बहुत अच्छा था आपका एक्सप्लेनेशन,
समझ आ गया।
सर
बहुत
आपको
अच्छा।
सुनना हमेशा
समझ
से एक
आया।
बहुत अच्छा एक्सपीरियंस होता है।
सर समझ भी आया है, बट और सुनने का भी मन है।
हाँ सबको दोबारा बुलाएंगे।
So really appreciating. I'm from Pakistan.
अरे वाह, गुड
गुड।
थैंक यू सर। आज के लिए नहीं, जब भी हमने बुलाया आपने उसी दिन का समय दिया है और वही टाइम दिया जिस समय हमने बुलाया, उसके लिए थैंक यू।
थैंक यू वेरी मच सर।
थैंक यू सर।
थैंक यू सर।
डॉक्टर
Yes, sir.
अर्पणा भी है। डॉक्टर अर्पणा इज ए ग्रेट मोटिवेटर।
अच्छा
नहीं सर, ऐसे मत बोलो। आपने मुझे बहुत मोटिवेट किया सर, फ्रॉम द वेरी फर्स्ट डे जब मैं आपसे फर्स्ट टाइम मिली थी। मैं 1M देने से बहुत डरती थी, मैंने आपके कारण 1M देना सीखा है।
कैसे?
मैं 1M की डोज देते हुए डरती थी सर। मुझे
अच्छा
हमेशा लगता था एग्रावेशन हो गया तो मैं कैसे संभालूंगी।
अच्छा, यू
बट
वंस टॉक टू मी इन दिल्ली, कौन से विज्ञान
यस
को
सर,
पता नहीं, आपने मेरे से एक क्वेश्चन
हाँ,
याद आ गया मेरे को।
विज्ञान भवन ही सर, विज्ञान भवन की बात।
याद आ गया।
हाँ, नहीं सर, हम अभी भी मिले थे थोड़ा टाइम पहले।
Yes.
तो सर आप ही ने मुझे बोला था कि डरो मत, कुछ नहीं होगा, दो। उसके बाद से सर मुझे अब डर नहीं लगता, मैं 10M भी देती हूँ अब।
गुड, रिजल्ट भी बहुत अच्छे आते होंगे, ऐसा नहीं है।
यस सर, सर यस सर।
हम्म,
सर मैंने ऑटिज्म के पेशेंट को 1M दिया, बहुत डरते डरते मुझे ये था कि अगली बार आएगा तो पता नहीं क्या होने वाला, आएगा भी कि नहीं आएगा।
हम्म।
बट ऑल बिकॉज ऑफ यू, बहुत अच्छा उसने मुझे रिजल्ट दिया।
नहीं, ऑटिज्म में बहुत अच्छे रिजल्ट्स हैं, बहुत ही अच्छे रिजल्ट्स हैं। ये हम होम्योपैथ जो है दुनिया को दिखा नहीं पा रहे हैं, बट ऑटिज्म अभी तो मैं ये क्लेम कर सकता हूँ कि ऑलमोस्ट 100% क्यूरेबल है।
यस सर।
तो वेरी गुड रिजल्ट्स इन ऑटिज्म। आई एम
मैं
गेटिंग
आज ही सर मैं किसी को बता रही थी, सर तो ऑटिज्म के स्पेशलिस्ट है।
वेरी गुड रिजल्ट्स, वेरी गुड। Inevitably you get the result because I'm using that theory of five uh, elements. You know, our body is made up of five elements: space, air, fire,
वाटर,
earth, and water.
वाटर।
So how you relate autism with these five elements? Can anyone tell me? मेरी वेबसाइट पे पढ़ा है सारा। तो आर फाइव एलिमेंट्स आर we it is in our shastra, it is called panchbhut, five elements, and five tanmatras. Tanmatras means ये यूनिवर्स में ये जो पांच एलिमेंट है, हमारी बॉडी को इनके साथ कनेक्ट करने के लिए 5 पॉइंट्स हैं। these are ear, our ear represent the space, आप कहते हो आकाशवाणी, so all hearing is through space, so here ears they represent the space element. Then second element is fire element. In our shastras it is like शब्द स्पर्श रूप रस रंग। अगर आपने कभी पढ़ा है हिंदी मैथोलॉजी को, उसमें ये लिखा है कि हमारी जिंदगी इन 4 रसों पे टिकी है: शब्द स्पर्श रूप रस रंग। तो ईयर्स दे रिप्रेजेंट द शब्द, हियरिंग। फायर मीन्स लाइट, टू सी एनीथिंग यू नीड लाइट, तो आर आईज एंड विजन
आइज।
रिप्रेजेंट द फायर एलिमेंट। Then comes the earth element, means gandh. Sugandhi, earth is the smell element, nose is earth. Then touch element is air, हवा छू के निकल गई। To experience air, you need touch. Air touches us. So touch, skin, tactile is the air element, and taste is water element. In autism, it is not a psychiatric disorder. This is a neurosensorial disorder. So if you see the autism symptoms, either they are touch sensitive or touch avoidant. Either they are auditory sensitive or auditory avoidance. Either they are taste, oral seeker or oral avoidant. Same way, they are vision seeker or vision avoidant. This action of the autistic child is visionary seeking because their peripheral vision, they like. So I take these 5 senses into consideration, take appropriate homeopathic rubric, and prescribe 100% result. Well, I'm not claiming that I'm giving 100%, but homeopathy gives 100% result. Although there are some cases where we don't prescribe the right remedy, so but otherwise homeopathy is 100% capable of 100% cure of autism. So that is what I have came to an approach, and I'm using it, and it is invariably working. Although I have not written any literature and it is not anywhere in literature, if you Google it, you cannot find it. But I have seen it with my practice.
समीक्षा,
हाँ जी,
सर को बाय
डॉक्टर
बाय
मुकिंदर
करो।
का नाम लिख लो इनका, ऑटिज्म पे नेक्स्ट लेक्चर लेंगे जूम पर।
जूम पर बिल्कुल लिख लेती हूँ सर
जनवरी
का।
या फरवरी
सर
में
2
जब भी
आवर्स का
टाइम होगा
लेना।
ना। हाँ
नहीं,
सर, जब
ऑटिज्म
तक
ऑटिज्म ऑटिज्म का आई विल प्रेफर अ फिजिकल लेक्चर, नॉट द जूम लेक्चर। वो नहीं आप
यस
बना।
सर, सर
मैंने
ठीक
भी
कह रहे हैं।
मामीरा में दिया था 3 घंटे का लेक्चर, यू नो, लोकल लुधियाना में। तो ऑटिज्म को अगर समझना है विद केसेस, तो यू ट्राई टू हैव अ फिजिकल
हम
वर्क
ध्यान से
रादर देन दिस। जूम पे नहीं
ध्यान
जस्टिफाई होगा।
सर आप
फिर
लुधियाना बुला लो।
लुधियाना बुला लो, हम आ जाएंगे सेमिनार कंडक्ट करने वहां
बनाते
पे,
हैं कोई प्रोग्राम बनाते हैं।
मार्च
डेफिनेट
अप्रैल में बुलाना ठीक है ना, हम भी आ सके वहां पर ठीक है। बाकी तो एक बार तब तक आप हमें यही जूम पे ही सिखा दो ना, वो तो आएंगे ही आएंगे लुधियाना भी अटेंड करने उसके लिए आपका नाम नोट कर दिया, हम बाकी बुलाते हैं जल्दी ठीक है सर।
ओके, बाय बाय।
ओके
ओके बाय,
सर,
थैंक यू वेरी मच सर।
सर
थैंक यू
थैंक यू
वेरी
वेरी
मच।
मच।
थैंक यू सर।
थैंक यू जी।
थैंक यू सर, थैंक यू।
थैंक यू
कल फिर
सर।
मिलते हैं हम नए चैप्टर के साथ, मिस मत करना, बाकी के लेक्चर्स भी बहुत अच्छे होने वाले हैं। थैंक यू, बाय बाय, टेक
थैंक
केयर।
यू, बाय
साक्षी
बाय।
लाइव बंद करो बेटा।